Hey, this is Dr. Carpenter. I was just talking to William about your mom's care here. So, we think that her confusion could have been related to a number of different things. Some buildup of toxins and things that the kidneys usually clear because of her renal failure. But that now that she's had dialysis, that should be taken care of, and we're not seeing any medications or anything else on her list that would make her confused. Looking back through her MRI of her brain last year, she does have some age-related changes that could be some signs of early dementia or cognitive impairment, which is very common in patients that have chronic kidney disease. Anytime you have any vascular or age-related changes to the brain or the blood vessels, they tend to progress more rapidly when the kidneys aren't working and clearing toxins and managing electrolytes the way that they're supposed to. So when she underwent the cardiac procedures, also sometimes pieces of calcium or plaque get flicked off during the procedure, and can sometimes go to the brain and cause very small strokes that aren't recognized because they don't cause arm weakness or facial droop or anything like that. If there's a lot of little tiny ones that happen, they just have a tendency to add to patients having slowed cognition. And so we're going to do an MRI of her brain today to see if we can see any signs of that happening. But I suspect that the treatment moving forward is going to be mostly focused on just trying to keep her body strong and her nutrition good. That a lot of the stuff that's going on here is related to age-related problems with her body, her kidneys and her brain not doing well. As far as the breathing we talked about, she does have some tightening of her aortic valve and some stiffening of her heart muscle. Both of those things cause a buildup of pressure in the left ventricle, and then that pressure backs up onto the lungs. It only takes a little bit of swelling in the lungs to make people feel very short of breath. When people get up and walk, that pressure typically goes up and the shortness of breath is worse. So we think that's what's going on with her breathing and her needing oxygen and feeling short of breath. And the valve typically just gets worse over time. It's not bad enough right now that she'd qualify for a replacement. The way to manage that is by managing the pressures in the heart through controlling the blood volume. People with what we call heart failure tend to have issues with volume overload. And so every time they dialyze her, they take fluid off to try to keep the volume normal, which helps manage the swelling and pressure and back up onto her lungs. But even with normal volume, she still will feel short of breath when she walks. It's part of the heart problem. Okay, is that it?
Yeah.
All right.
Okay. Thank you.
Yep. Hey, good luck.
Okay, see ya.
See you later.